Hello, everyone. Welcome to Career Cloud, hosted by Give Specific. I am one of your hosts, Dr. Amber Rains, and today I am here with Dr. Melissa Nelson. Hi, how are you?
Good.
Wonderful, wonderful. I will read her bio and then we will get into the discussion. Dr. Nelson was born in Texas and lived there until age 9, when her family moved to a small town called Butler, Georgia. She lived there through high school. After graduation, she enrolled at Mercer University in Macon, Georgia, and completed dual degrees in biology and French on the pre-medical track. She delayed medical school immediately after college, married her husband, Ben, and together they moved to Dallas, Texas, where he started medical school, and she joined a basic sciences research lab studying liver and colon cell biology. While in the lab, she was accepted into medical school at the University of Texas Southwestern Medical School in Dallas, where her husband was already completing his MD and PhD degrees. And she started medical training in 2012. Melissa graduated in 2016 and started the internal medicine residency program at Baylor University Medical Center in Dallas, which she completed in June of 2019. Since finishing residency last year, she has again joined a basic sciences research lab studying esophageal diseases and also works as a hospitalist physician at the same hospital where she did her residency. Dr. Nelson and her husband have a 2-year-old son named Elijah and a French bulldog named Hamilton. Dr. Nelson, welcome to Career Cloud.
Thanks for having me.
Thank you. I'm so excited to have you for a number of reasons. One of those includes our connection to Taylor County, as she mentioned in her bio, Butler, Georgia, as well as Mercer. We both ended up going to undergrad, at least at Mercer University.
Great place.
So I thought we'd begin with, how did you become interested in internal medicine?
Well, it started with an interest in medicine in general, I guess. I just grew up liking doctors, I guess. They just seemed like they knew what they were doing. You know, they just had command of the room. I had a lot of respect for them. And, you know, I liked science as I went through high school. And I knew I wanted something that was going to be challenging. I knew I didn't want to just do the same thing every day. I knew I didn't want to go into a job where I got bored. And I knew medicine was going to be that. So I picked just generally medicine, I think, in high school. And like you said, my bio followed it throughout college. Internal medicine came about during my medical school years. It's the most basic form of medicine to me. It's, you know, the kind of general doctor you see as an adult who kind of does all of the heart disease and lung disease and kidney disease. It kind of covers everything. I felt like they were the doctors who got to think through things the most. You know, not that surgeons and the other doctors don't think, but I just was geared more towards, I liked problem solving and I wanted to sit down and think about a patient. And that's kind of what internal medicine does, as opposed to some of the other specialties that are a little bit more hands-on and procedural. And some people have the complete opposite perspective on that. Some people just want to do. So yeah, that's what I liked about internal medicine.
Thank you. So going from that question to what was in your bio, can you talk a little bit more about your career path? I know a lot of students may be thinking traditional routes, but I thought it was very unique in focusing on research and how even now, you know, you're still working in research. Could you talk a little bit about your career path?
Absolutely. Yeah, it's not, I have not taken a traditional path. I mean, I went through college, I went through pre-medical. That part was, I guess, traditional, but I got into medical school my senior year of college, kind of late, but you know, I just decided to delay. I didn't think it was the time. My husband and I had really already kind of planned a life in Dallas, Texas, and it was just kind of not in the cards at that time. And Um, I'd become interested through my biology courses in college in biomedical research. I, at that point, kind of didn't know if I wanted to follow more of a PhD graduate school biomedical research or if I wanted to continue. Ultimately I did follow the MD route, but that research, I mean, it did a few things for me. It gave me a better appreciation for kind of what goes on in our bodies at the molecular level, which is important to know when you may be treating somebody, who's a big person, it's not, you're not looking at their cells and genes and molecules, but that having that underlying knowledge, I think, is useful as a doctor. And then also, I mean, just from a purely practical standpoint, medical schools are looking for research. Really, like they like to see that you have an interest in it. They like to see that you've done that because it shows that you're committed to understanding human biology down to the very smallest level. So I was really thankful that I went into research prior to going into medical school for those reasons. And I then went to medical school, obviously, went straight into residency in internal medicine, like you said. And after I finished as I was finishing residency last fall or winter, I kind of was presented an opportunity to continue in research, which I kind of dropped I hadn't really done much with it during medical school and residency. And I have an interest in gastroenterology. And so I kind of got back into this basic sciences of diseases of the esophagus. So it's been great to get a deeper understanding of that, understand some diseases better than I did before. And I think it's, it's a career that's, during this pandemic, it's allowed me a lot of flexibility. There's a lot of reading and writing that you can do outside of the actual lab environment. And it's been good.
Exactly. And I guess what it made me think about was how not only are you solving patients' problems, but by researching and having that research background, you're also adding to the body of knowledge while simultaneously taking care and solving problems with your patients.
Yeah.
And just in case someone isn't familiar with a hospitalist role, that focuses on treating patients at the hospital.
Yeah, it's under the umbrella of internal medicine. And, a traditional internal medicine doctor sees patients in their clinic, outpatient. They come in to have their high blood pressure or diabetes or whatever, to talk about their kind of not acute issues with the doctor. And they follow those. So the hospitalist role is purely in the hospital. We don't have clinics. We don't have an outpatient group of patients that we see. We only see people who are admitted to the hospital. And what I do specifically is I really do that admitting part. So when somebody first comes into the hospital, comes through the emergency room, I'm the one who sees them and kind of figures out what I think is going on in terms of coming up with what we call a differential diagnosis, meaning I think their shortness of breath is due to pneumonia, or maybe it's due to COPD, maybe it's due to coronavirus. I come up with what I think is going on and kind of start the treatment as they're being admitted to the hospital. And, that's picked up by someone else the next day. And so, yeah, I love it. Yeah, I do that so I do both. I'm a little confusing because I do both the research full time and I pick up hospitalist shifts every month. So,
and the roles, are they pretty much separate, or do they ever intersect at all?
They're pretty much separate, although I have admitted people to the hospital with the diseases that I study. So that's always fun to make a diagnosis or have somebody who's already had that diagnosis of because I only study a handful of diseases within esophageal diseases, and it's always interesting to see them in real life and see the treatments that we study in real life. So.
You study when it comes to those diseases. Are you studying very rare ones or more common ones?
Fairly rare, not super rare. I hadn't heard of these diseases until at least medical school, if not residency. One is called eosinophilic esophagitis, which is just, it's kind of an allergic disease. It's in the same category, or the people who have like asthma, eczema, seasonal allergies. This is another disease that's kind of under that umbrella. And then the other one's called achalasia, which is a disease of the smooth muscle in your esophagus. So that makes you have trouble swallowing and other problems.
Thank you. And the reason I sort of continue to ask questions is the latter one. My mom has.
Oh, no way.
So she had surgery at Emory when I was maybe 7.
Yeah.
So that's the only reason, that's the only time I've ever heard of the term, but I was just curious to know.
But you have a personal connection to it. Yeah, it's not many people have it, but it is out there. Yeah.
Exactly. So I wanted to talk about your, I guess like a typical day for you. So having 2 roles, or is your week split, or how does it work navigating having multiple roles?
Yeah, and this has been very different in the last few months. Like for most people, it's just been, I've been a lot at home, a lot more, like I said, reading and writing. But a typical week, I kind of business hours 9 to 5 is more my research time. So I'll either be in the lab or at home doing, if I'm in the lab, I'm doing some kind of bench research. I do a lot of cell culture, if people are familiar with that. Pipetting, basically, what you'll do in like your college labs, that kind of thing. And then my hospitalist job is almost exclusively nights. So I do either a 7 p.m. to 4 a.m. shift or a 10 p.m. to 7 a.m. shift. So I'll often have been in the lab that day and then go in at night and then sleep for a little bit the next morning and go back to the lab, if it's a weekday. So it gets a little hectic, but yeah, that's generally what I've carved out as what works for me, doing both roles. So, I mean, I get downtime. I really, sounds like I work all the time, like night and day, and I really don't. I mean, I have downtime too, but that's generally what I've set up.
And it's great. I find it really fascinating to have dual roles, but to have a schedule that works, for you to be productive and be impactful. So that sort of brings me to, what do you enjoy most about the work that you do?
It's just generally the problem solving. That's, like I said earlier, I didn't want to go into something boring. I didn't want to go into something where I was doing the same thing every day. And every patient who comes in is different. Every patient who comes in is an opportunity to see something new, to think about things in a different way. And I mean, it's with real people. So, at the same time, there's kind of the science, cool academic part of a patient. And then there's like, this is a real person who's here suffering and pain, afraid, whatever it is. And I always liked interacting with people, always liked meeting new and interesting people. And so, you're kind of doing both at the same time. You're thinking about them as a person and how can I help this person feel better? And wow, this person has an interesting disease, but how am I gonna tackle this disease or this problem they're coming in with? So, I mean, that part, like, of the clinical medicine side, it's still, I love it. My husband's a doctor too, and we often will, spend hours at night talking about interesting patients we've seen with, de-identified. We don't talk about patients' names or birth dates, anything like that. But we, like, oh my gosh, I had this guy come in with whatever. And so we both just love talking about the interesting cases we see. And, the research, I think, is kind of it taps into a similar thing that I really enjoy with problem solving. I mean, that's all that it is. I want to find out what gene does this in this pathway. What experiments am I going to run to figure that out? And, if this experiment doesn't work, I need to move on to something else. And then you go back to the literature, you read, you figure out what you might be missing. And so I think they both kind of work for me in a similar way.
In problem solving.
Yeah, that's it for me.
Okay, the next question that I have is in the last 5 years, what new belief, behavior or habit has most improved your life?
I mean, I've already touched on this, but just not knowing that I don't have to follow a certain path just because other people have. I mean, if you go into medicine, it's just very scripted for most people, which isn't a problem, but you know, you go from pre-med in college to medical school, right from there you go to internal med, or sorry, any residency. Right from there you go to a fellowship or to practice, and it's just, you go straight through, and mine didn't go that way, and that's okay. It's okay that I'm a couple years older than you know, people who are at my same stage. You know, these things are not, there are times in my life where I think that that bothered me, or it's like, why didn't I just, you know, go straight into college, or straight into medical school from college, and realizing that that's okay to follow a different path. And also that sometimes it's great. Like sometimes you discover things that are really meaningful to you, like research for me, through following a different path than what other people do. And everybody's different. Everybody has their own unique needs and talents and path in the end.
Exactly. And having that unique, I would say, strength actually adds to the class. So if you're thinking about residency, your perspective could be different from the others who have had more of the traditional route. And you can always, you could, you know, even now, bringing in research to, you know, into the hospital setting and opening minds of, you know, not only doctors, but other residents as well.
Yeah, yeah.
Okay, and what advice would you give to, speaking of residents and interns, what advice would you give a smart, driven college student about to enter the real world?
Yeah, there's so much that anyone can say. There's so much to know. I wrote down some thoughts because I was like, how do I organize my thoughts on this? Um, I think one thing I recognize, maybe in myself and other people I've been in contact with, is don't feel like you have to continue down the same path you start on. Maybe this is just, I keep going back to the same thing maybe, but meaning like if you start out in a major in college that isn't really working for you, it's okay to switch. It's not the end of the world just because you said, I'm going to be a doctor when you were in middle school or high school. If you don't like it, you don't have to stick with it. I mean, I think that's something that we're all kind of brought up with. Never give up. Don't give up, you know, your dream. And that's good to an extent. I think that that's, in general, you shouldn't be a quitter, you know, just because things get hard, you don't have to quit. But I think that as I've gotten older, I've realized what strengths I have and what weaknesses I have. And I don't think I knew what those were when I was 18 years old or, you know, starting out. And you find that there are certain things that maybe this career is not for me. Maybe I'm not good at whatever it is. Maybe that's not part of my skill set. But I'm good at these other things, and I'm passionate about these other things that I'm kind of finding. And I think that's when I got to college. I mean, I guess I'm one of the people who wanted to be a doctor, and I did continue to follow that. But I mean, there were just things I never considered. There were jobs I never considered, majors I never considered. And I think just keeping an open mind it's important, not just, you know, when you start off in college, but when you start off after college, just understanding that it's okay. You're not a failure if you don't continue in the path you started off in. I think that's an important thing. In medical school, I had classmates who started and didn't finish because they realized that they were smart enough to get into medical school. They were smart enough to get all the way through, but they didn't like it at all. They just never kind of reevaluated along the way. Do I really want to do this? And they made it all the way to medical school before realizing I hate this. And so I think that's an important thing. Just always reassess. Do I like what I'm doing? Am I passionate about this? Am I good at it? Or do I need to find something else that I'm more passionate about or better at, or whatever the case is. So.
Thank you. Thank you. And as we get ready to transition out, we've discussed all of the great things that you've done and that you're doing, dual roles as a researcher, as well as working and an internal medicine physician. The next question, and we'll close out from here as our final question, is when you feel overwhelmed or unfocused, how have you, or even lost your focus temporarily, what do you do?
Yeah, being overwhelmed is maybe just part of this. I struggle with a lot of anxiety, and you have to have an escape. I mean, in any career, in any anything, you have to have an escape. And I think for me, it's refocusing that being a doctor is great. That's part of who I am, but that's not all of who I am. Like I've said, have a family. I have my husband and my son Elijah, my dog. I mean, I have it kind of mental escapes from it for when I get overwhelmed. And, you know, we have things we do as a family that kind of help me get away from it. And then also, you know, when I start thinking about everything in life, and I think anxiety is just amped up to, you know, way beyond what it has been in the last few months dealing with the pandemic. I like to just write out everything I feel anxious about, because it just kind of gets in this big anxiety ball for me. And I don't even know what I'm anxious about anymore. It's just, I just feel like this weight. And so I think just writing out sometimes okay, I feel anxious about this bill that's due and this, you know, thing I have to do and this, whatever. I think just writing it out just helps me kind of organize, like, okay, it's not all that bad. I just have to deal with these few things. And I think just that works for me. I guess it's just find what works for you when you get like that. Don't just sit under the weight of your anxiety. Kind of find a way to escape, but sometimes you can't escape. When you can't escape, find a way to diffuse it and, you know, to organize it into a few different things and tackle each one. So.
Exactly. And I'm so glad that you mentioned reflective writing. So that's one thing that we really want students to utilize after these interviews, as well as to utilize as they navigate the trajectories of life, so to speak. So I want to say thank you for your willingness to take time out of your busy schedule to do this interview. Thank you for the work. Thank you for the research that you're contributing. As I know of people that will be directly impacted by your research. So thank you again as well.
Yeah, thank you so much for the opportunity. Great talking.
Great. And then I'm going to close out by saying, we'd like to invite you to follow and subscribe to the Give Specific YouTube channel, as well as follow us on Instagram and Facebook for these interviews. In addition to the interviews, you will be able to download a free reflective worksheet to help you in navigating your educational journey. And we invite you to become a member through our Patreon at patreon.com/givespecific. Thank you so much, Dr. Nelson. All the best to you.
You're welcome. Thank you.
Thank you.